Hello, everyone, and welcome to the Osteoarthritis Action Alliance Lunch and Learn webinar for April 15th, 2020. Thank you so much for joining us today. We're pleased to share a national public health agenda for osteoarthritis, the 2020 update with you. We have 3 presenters today, and I will introduce all of them now in the order in which you will hear them speak. Dr. Leigh Callahan is Director of the Osteoarthritis Action Alliance, a coalition of over 100 public health leaders and stakeholders committed to elevating osteoarthritis as a national health priority. She is the Mary Links Briggs Distinguished Professor of Medicine in the School of Medicine and Professor in the Departments of Social Medicine and Orthopedics at the University of North Carolina, Chapel Hill. She's an adjunct professor in the Department of Epidemiology in the Gillings School of Global Public Health and the Associate Director at Thurston Arthritis Research Center and Director of the UNC Core Center for Clinical Research. She has taught clinical epidemiology and aging and health courses at UNC Chapel Hill. Dr. Callahan has an undergraduate degree from UNC Chapel Hill and a PhD from Vanderbilt University. Dr. Callahan has over 30 years of experience in arthritis and health outcomes research and experience in public health as a former arthritis epidemiologist with the Centers for Disease Control and Prevention. Laura Whalen has worked in public health for over 20 years and joined the CDC's arthritis team and the Arthritis, Epilepsy, and Wellbeing branch on April 1st, 2019. She's an epidemiologist by training and worked for 15 years in program evaluation and surveillance in HIV/AIDS prevention, school health, children's mental health, veterans' mental health, and tobacco control. Prior to coming back to work at CDC, she worked at the Georgia Department of Public Health as the evaluator of the tobacco program. From 2013 to 2019, Ms. Whalen was a project officer in the CDC's Office on Smoking and Health. Collaborating with local, state, and federal partners on public health policy adoption and implementation have been the most impactful and rewarding parts of her work. Outside of work, she is a voracious reader, dog lover, weather watcher, and jewelry enthusiast. Dr. Eakin is responsible for the Arthritis Foundation's medical research strategy. Central to his role is overseeing the organization's flagship research support program, which seeks to improve lives by applying the power of scientific research to the problems facing people with arthritis and public programs of the foundation. Dr. Eakin also oversees the Arthritis Foundation's leadership role in working with other foundations, government agencies, and industry partners to tackle barriers to the advancement of patient health. These activities have led to founding roles on several conferences and projects related to his work. Interviews with Dr. Eakin related to funded programs have been featured in the New York Times, TED Med, National Public Radio, AARP Bulletin, and other prominent venues. He earned his PhD in developmental biology from Baylor College of Medicine. Before moving to the nonprofit sector, Dr. Eakin continued research in developmental biology at MD Anderson Cancer Center and Memorial Sloan Kettering Cancer Center. And now we'll get started with Dr. Callahan's presentation.
To all of the participants today for joining us. We're very excited to preview the 2020 OAA agenda update. This is going to be officially launched on May 4th. I'm going to briefly review the history of the OAA agenda that was published in 2010 and note a few highlights and accomplishments over the last decade. Then I will turn the presentation over to Laura Whalen to describe our rationale and process for updating the agenda in 2020. Eakin will follow Laura with a review of the strategies of the 2020 update, and I will close with next steps, followed by time for questions from the 3 of us, as well as Nick Turkus, who will be joining us from the Arthritis Foundation. And something has happened to my Zoom, so I can't see what slide is up, but slide of the history of the OA agenda, Katie. The OA agenda, the history goes back about 45 years. In 1975, the National Arthritis Act was established in this country, followed in 1985 by the National Institute of Arthritis and Musculoskeletal and Skin Diseases being established at the NIH. Public health really came into the forefront in 1999 when the CDC and the Arthritis Foundation developed the National Arthritis Action Plan, a public health strategy. And then out of that, in 2010, the National Public Health Agenda for OAA was established. Next slide. The National Public Health Agenda for OA, established in 2010, was developed by the CDC, the Arthritis Foundation, and 70 stakeholders. This really set the stage for collaborative and focused action to prevent and control osteoarthritis. The blueprint this blueprint was from which the Osteoarthritis Action Alliance emerged in 2011. And the OAA, or the Osteoarthritis Action Alliance, is a broad coalition of organizations that seeks to reduce the national toll of OA. It operates under the principle of strength in numbers. One larger voice is much stronger than a single organization alone. Next slide, please. The goals of the agenda focus around three main areas: ensuring the availability of evidence-based intervention strategies, the establishment of supportive policies, communication initiatives, and strategic alliances, and then the need to initiate needed research. Next slide, please. 10 recommendations were highlighted in the 2010 agenda. And these 10 recommendations are noted on this slide. They focused around evidence-based interventions from a public health perspective, particularly around weight management, physical activity, self-management, and injury prevention. And the recommendations also focused on systems and policy changes that could be made to ensure that focus on OA public health was covered throughout the nation. Next slide. As I noted before, the agenda of the Osteoarthritis Action Alliance was established in 2011 to put forth the recommendations in this agenda, and it's grown to over 115 member organizations. The organizations represent a wide variety of sectors, including professional societies, community-based organizations, aging services, health and wellness benefit groups, academic institutions and research centers, hospitals, healthcare centers, industries, legislators, and policymakers. It's by no means exhaustive. We also have individuals who participate who are field experts, as well as people with arthritis. Next slide, please. The Action Alliance operationalizes the 10 recommendations that I noted around 5 main areas. These include policy and advocacy, community engagement, healthcare systems and provider mobilization, individual engagement and education, and osteoarthritis prevention. We've created a comprehensive communication plan outlining tactics, target audiences, messaging platforms, and the collection and evaluation of reach and engagement metrics. We've also utilized our member organizations and other partners to successfully disseminate information about OA prevention. We launched the Stand Up to OA campaign, which has a variety of readily available and free tools, videos, resources, and infographics. We also have developed a comprehensive compendium of communication outlets, including websites, social media, webinars, articles and videos, Facebook pages, Twitter, Instagram, and more, and developed 2 comprehensive educational toolkits targeting pharmacists as well as a broad range of primary care providers to promote education about osteoarthritis and to encourage referral patients to evidence-based interventions. Next slide, please. This just highlights some of the Action Alliance resources and efforts to put forth the recommendations from the 2010 agenda, including Lunch and Learn webinars, that we're having today, newsletters, and as I noted, like the Stand Up to OA Digest, other resources, policy guidelines, patient-friendly resources such as an action blog, and programs. So now I'm going to turn it over to Laura to talk about the update of the 2020 update.
Great, can you hear me? Oh, great, can you hear me okay? This is Laura.
Yes, we can hear you.
Great, thanks, Katie. And thank you, Leigh, for going through the history and kind of setting the stage for where we are now, which is at the launch of the 2020 update for the National Public Health Agenda for Osteoarthritis. The purpose of this update is really in keeping with the 2010 purpose for that first report. And that is that we envision a nation in which adults with OA are able to live full lives with less pain, stiffness, and disability, greater mobility, and preserved function and independence. And as we went through this, we established that we can best accomplish this purpose by ensuring the availability of evidence-based interventions to all U.S. adults with OA, to establish supportive policy communication initiatives and strategic alliances for OA prevention and management, and lastly, to pursue needed research to better understand the overall burden of OA, its risk factors, and effective strategies for prevention and intervention. Next slide, please. So the reasons for updating the agenda, as I mentioned earlier, are manyfold. But from this graphic on this slide, we wanted to start with burden of osteoarthritis. So 1 in 7 adults in the United States have osteoarthritis, which comes out to approximately 32.5 million U.S. Americans, adults that have OA. More than 50% of adults with OA are of working age, and that's approximately 18.7 million people. OA costs approximately $65.5 million in annual medical costs. On average, OA costs $2,018 per person per year in medical costs, and OA results in $71.3 billion in earning losses as a result of this disease. Next slide, please. But beyond the obvious, there's also a number of things that have happened since the 2010 update. As before, OA is still an under-recognized chronic condition. There are significant gaps in delivering the 4 public health interventions for OA, and we'll go into that a little bit later in the presentation. There's been an explosion of the internet access and advancement in mobile communications, which has boosted connectedness since the 2010 original agenda, which I think has been a good thing. Several key reports and policy initiatives have changed the landscape for addressing the public health burden of OA. And lastly, the public health community's interest in OA has grown considerably. The OAAA now boasts a coalition of more than 100 member organizations, and Leigh pointed out in her presentation the variety of different OA member organizations that are part of the OAAA now. Next slide, please. So the process that we took to do the 2020 update included first CDC, the Arthritis Foundation, and the OA Action Alliance and its members coming together to review the 2010 recommendations, and then to discuss between us what the National Arthritis awardees might need for their work, as well as other collaborators. So we asked a number of our review folks to look at the 2010 agenda and consider what had occurred in the last decade that would impact the update for 2020. So we asked them essentially three questions. What did we get right and what did we get wrong? What strategies were still relevant, and did any of the strategies need to be modified? And then lastly, what was missing? What new strategies could move us forward during the next 5 to 10 years? These responses were compiled, analyzed, and reviewed, and the 2020 agenda update drafted based on this input. Next slide. Some of the key milestones was that in February 2019, we did a kickoff meeting with key stakeholders, and those were the OAAA Action Alliance, CDC, and the Arthritis Foundation. In the spring and summer of 2019, we reviewed the 2019 agenda objectives, strategies, and goals with a whole array of stakeholders, as I just mentioned. The OAAA Action member organizations, key experts, and other partner organizations. In late summer of 2019, we did a review of the updated strategies. In September of 2019, the final draft of the report was reviewed by the OAAA Action Alliance membership during their annual strategic planning meeting. And in February 2020, a final report was completed. Next slide. And now I'm going to turn it over to Guy Eakin from the Arthritis Foundation to go through the 4 public health interventions and then talk a little bit more in depth about the strategies that have come out of the 2020 update. Guy?
Hi, thank you. So yes, on the behalf of the Arthritis Foundation, I really want to take a moment to appreciate the privilege of speaking with everyone today. Been really pleased to be a part of this work and what's been a really incredible collaboration that I hope everyone sees reflected here. That collaboration resulted in this agenda, and what you're seeing on the board right now is this agenda identified and recommended these 4 public health interventions of weight management, self-management education, physical activity, and injury prevention as known prevention strategies, and all strategies that are known to be a part of managing osteoarthritis once diagnosed. And so the fact that all this seems very simple and approachable is no accident. That's the result of what I acknowledged earlier as being an incredible collaboration. But despite, as we move to the next slide, despite the evidence of benefits for adults with arthritis, the participation rates in self-management programs we know are low. And only about 11% of adults with arthritis are participating in these programs. But there is a slight increase, in participation of about 17% for adults that report arthritis attributable activity limitations. And so as we move beyond the rationale into the actual recommendations on the next slide, what we can begin to say is that I'm going to review these in greater detail in the coming slides, but for the moment we can suffice it to say that we're suggesting a modest and certainly approachable list of actions that leverage interagency and public cooperation to support strategies that support osteoarthritis. But I think what you'll recognize very quickly is that these also often serve other chronic diseases, with data-driven approaches to research and the deliveries of those programs. So the next slide is just a preview of the items that we're going to go into more detail on. So if we could flip to the next slide, I'll give you a chance to just a chance to review those briefly, and then we'll say a few words about each of those elements on the screen. So, number one is that consistent with many of the new treatment guidelines, physical interventions, including exercise, have a tremendous role in the public health approach. And these need to be better understood and better communicated to both the patients, the providers, and also the communities. So can we hit the next slide? And as we expand on the ideas in that last slide, we're specifically advocating for low impact physical exercise, and then on the third recommendation, a real focus on weight management and promotion of that weight management for both prevention and treatment of osteoarthritis. So next slide. Can't all be new. We really need to deliver on existing policies, and that implies strong surveillance of programs that are already known to reduce fall and OA-related joint injuries. And then in the fifth recommendation, it can't all be newsletters. People have to be referred to these interventions. We advocate expansion of those delivery systems under the theory that, just because you built it, patients might not come. We need to expand that referral and really get patients in connection with the programs that have an evidence base behind them. If we move to the next slide, and as we deliver, we know that the people who are most difficult to contact and connect with are often also the most susceptible to harm for osteoarthritis. How do we assure that a rational approach to health disparities is in place, and how do we deliver equity and access to all the programs that were alluded to in earlier slides? And also, how do we pay for those? So if we move to the next slide. It's very logical that all these things that we've described in the earlier slides are good recommendations, but they also have to become good policy, and that public health policy work has to be provided for. So that's going to require engagement with many stakeholder partners in our communities. Again, speaking to the idea that as Leigh started the talk off with, the role of the CDC and the Arthritis Foundation in establishing the OA Action Alliance was very prescient, and that those 115 partnering organizations are likely just the beginning for the coalition that's going to be necessary. Can we move to the next slide? We have to be future focused. Our current programs are wonderful, but we need to imagine what the world would look like as new and effective programs are developed and adapted for specific populations. And the topics we find important to future research are listed on this board, right now, but certainly hit on many of the themes that we've already kind of alluded to in the conversation around surveillance, early diagnosis and treatment, refining existing, interventions across the workplace, across biomechanical interventions, refining our symptom management, but also developing new approaches. So that's going to take me to the next slide, which is the opportunity to return the conversation to Leigh Callahan.
Thank you, Guy and Laura. Next, we're just going to conclude before we have a little discussion with the next steps. And the next steps will include establishing a small group of stakeholders to monitor implementation of the agenda and share progress. We would like to solicit endorsements of the 2020 update from relevant strategic partners. We also plan to design and implement an evaluation plan to measure progress and outcomes. And then, importantly, develop supplementary materials, short briefs, tips for implementations, targeted to various sectors such as employers, decision makers, healthcare professionals, insurers, public health professionals, and other stakeholders across all the range of individuals who will be interested in this. So the official launch, next slide please, will be on May 4th. And we will hope that those of you on the call today and everyone else will read the full agenda update, which will be housed on the Action Alliance website, the CDC's website, the Arthritis Foundation's website. We hope individuals will use the briefs to educate stakeholder groups, and that our organizations and policy groups will use the briefs that we create and plan to continue to create. I hope that people will contribute to the evaluation by telling us how you're addressing the strategies in your organization, so we can keep an evaluation and an upgoing lessons learned, best practices across the nation and the world as to how this is being launched. So stay tuned for the May 4th launch. And next slide, please. I just want to highlight again all of the individuals and organizations who were so key to making this happen. The steering group was headed by Action Alliance, the Centers for Disease Control, and the Arthritis Foundation. And we also had a consultant with us, Susan Baker, who had been involved in the 2010 agenda. So that was wonderful. And Susan and Allison Albright really get a big shout out for all the work they did on pulling this together. And all of the team members were very, very valuable. Next slide, please. This slide just acknowledges also all of the additional supporters and reviewers of the 2020 update, individuals from universities, from various partner groups in the Alliance were very instrumental in making sure that we answered the questions that Laura reviewed, that we compiled visions and came up with the current strategies that Guy went through. So next slide. We are now all available for any questions that you may have for the three of us, as well as Nick Turkus from the Arthritis Foundation. Thank you.
While we're waiting for some other questions to come in, I was curious, for those of you who were on the steering group putting this together, whether or not you were involved in the 2010 agenda, what surprised you during this process, or what was something that you learned while you were going through the process of developing the 2020 agenda?
I'm happy to take the first stab at that because I was one of the individuals who was involved in both the 2010 and the 2020 update. And the thing that, well, it didn't really surprise me because so integrally involved is everything we've done, but the thing that is important is that the interventions, particularly the interventions around self-management, weight management, injury prevention, and physical activity are still highly relevant and very important. And that was reinforced in the American College of Rheumatology and Arthritis Foundation's recent guidelines for managing osteoarthritis, that those behavioral interventions are very important for overall OA management and still highly relevant.
I think for me, and this is Guy Eakin from the Arthritis Foundation speaking, I think for me, one of the things that was rather revelatory was the idea that our community structures within the Arthritis Foundation in particular could really be tailored to deliver interventions in a fairly new approach to public health. And so, you know, without going into a great amount of detail, what I would say is that the things that were surprising to me were that for a field that sometimes feels like it moves slowly at the pace of research, the amount of opportunity that exists, you know, for new ways of thinking is really incredible.
Yeah, and I'll take on to the end. This is Laura Whalen, and because I'm new to the arthritis world, all of this is new to me. But the thing that I found surprising in a wonderful way was just the collaborative nature of working with the Arthritis Foundation and the OAAA Action Alliance, and then the generosity of a vast number of people who really gave us some very thoughtful feedback and input for the 2020 update. Like we said, many of the recommendations were able to stay the same between 2010 and 2020, which I think speaks to the amount of work that was done in 2010 and the depth of it. But I was just amazed at the amount and the thoughtfulness with which the people who responded to our requests for reviews and input were able to give to us.
Great. Well, thank you for answering that that question. I do see another one here from an audience member who says, I was surprised to learn that the uptake by patients is only around 11%. How can we work together to increase the uptake of these programs by patients? I think that's referring to the self-management activities and physical activity.
That,
I mean,
go
well,
ahead.
go ahead.
No,
Go ahead, Leigh. And, yeah, I think we would all jump at that question,
Yeah.
but why don't you go
Right.
first?
that is the $64,000 question. We all feel like we know there are programs and interventions that could make a difference in people's lives, and how to reach the people who need them most has been a real mission of the Arthritis Foundation, the CDC, and the Action Alliance. We continually try to work with community partners, as Guy was talking about. We're now doing things within the Alliance of trying to develop a web-based portal to drive people where they could get Walk with Ease self-directed program through the portal without having to go to a specific class or do something like that. It's a challenge, and I'll let Nick and Guy jump in if they have some other ideas about how we could raise that number, because we all want to raise that number.
Sure.
Go, Nick, if you don't mind. Let me just say really quickly that I really appreciate the way the question was phrased as, how can we work together to increase the take up by patients? And, that kind of speaks to the attitude that if we had phrased that question as how do we get patients to participate in these programs, it would be very different. Meeting patients where they are, having a good understanding of the populations that we're serving, what their needs are and how to get into their communities and make the interventions that we have a full menu of interventions so that patients have a selection, from, and that would be targeted to that patient, for sort of maximum level of adoption, is going to be really the secret here. It's not going to be one size fits all, and it's not going to be forcing anything on anybody. So, Nick, I'm sure you have more
Sure.
detail.
Absolutely. I think what everyone is saying is correct, and I also think that certainly making sure that our healthcare provider friends are referring patients. We know that healthcare providers' advice is some of the most trusted health information that people with arthritis can get, and those recommendations are truly acted on. And so letting more physicians know that these evidence-based programs are available and sort of creating demand for them. And then I would also say is that for patients themselves, there is a certain sense for many patients with osteoarthritis that it is something that is predetermined and there isn't anything that they can, quote, do to make it feel better. And understanding that there are programs that truly work, that can really reduce pain and improve function, and talking to patients like marketers do to make them understand that they can live a better life with the use of these programs and the community that these programs create. I think that we'll have a lot more success in bringing more people to this agenda and in improving the lives for the people living with osteoarthritis.
And this is Laura Whalen. Thank you, Nick and Guy and Leigh. I think all of the information that you've shared is very true. And then through CDC, we do direct funding to 13 states to do arthritis work, part of which is to get the evidence-based arthritis programs out to statewide to people with arthritis. And then one of the strategies specifically around that is to do a connection between healthcare providers doing counseling and referring people with arthritis to the evidence-based interventions. And so those 13 states that are funded directly through CDC are working specifically on that strategy, some of which means that they're trying to do, in some of our states, to do electronic referrals, a closed loop bidirectional referral system where a healthcare provider who sees someone with arthritis can actually counsel and refer them to an evidence-based arthritis intervention directly through their electronic their electronic health record. And then on the receiving end, if that person decides to take the recommendation and enroll in one of the evidence-based arthritis associated interventions, then a note will go back to that healthcare provider to let them know that the person actually was enrolled and attended that session. So, as I said, not all of our states have quite gotten to the electronic referral, bidirectional referral method, but they are all working on that in some capacity to link in the healthcare providers to do counseling and referral, and then to report back to them about the patients who they have referred and people who have come in and actually hopefully benefited from those evidence-based interventions.
And I just wanted to add to that also, Laura, that the CDC has funded the National Parks and Recreation Parks Association and the WISE also to try to deliver more of these evidence-based programs. And I think many of the groups that are funded, states and individual community-based organizations that have been funded also by the Action Alliance, feel like the more we can create value propositions and get some of these programs paid for by the insurance companies or by Medicare programs, that also may help people take the programs.
Absolutely, and that's one of the sustainability strategies. The third-party payment strategy goes into the dissemination and making availability of arthritis appropriate evidence-based interventions. Strategy 1 from our cooperative agreement, that is something that our states are also working on, as well as their national organizations that are funded, and those are the National Park and Rec Association, Arthritis Foundation, and now I'm blanking on the other ones, OAAA Action Alliance,
National WISE,
the YUSA, thank you, and the National Association of Chronic Disease Directors. So those organizations are working on a national level to also do strategies to promote the distribution and accessibility of arthritis-associated evidence-based interventions, but also working on some sustainability strategies through third-party payment.
So it seems like these are examples of some specific strategies for operationalizing the agenda, but we did have a question come in asking for the strategies that you plan to use to operationalize the agenda and how the member organizations are involved in that. So I'll just offer it to the speakers if you all have anything to add to that.
I would say that that's part of the next steps is determining how we can best operationalize these with collaboration among all the various organizations, not just the 3 that are speaking here today, but all the 115 organizations that are interested in some way. So we will be, we've now got got another blueprint, and I think developing a plan for operationalizing it will be the initial next steps. The one thing, out of the box that we heard even when we were developing this, that it would be nice to have briefs for organizations or sectors that are in certain sectors, where to give them examples of direct actionable steps that they can take. So that is one of the first things we're working on, is to develop those briefs where it would give the industry sector or the healthcare sector some actionable steps that would help them move forward.
I would point out, one of the initiatives of the Arthritis Foundation this year, is to have an advocacy ask, for $1 for every person with arthritis being devoted to public health. So that's an ask of $54 million, to Congress to help support public health initiatives. Yes, we have to define, the next steps, but in terms of immediate actions, going and looking for a platform that supports our colleagues in research, and certainly within the agencies that we've discussed here today, would be entirely appropriate.
And I think from the CDC perspective too is, like Leigh mentioned, is really reaching out through our funded organizations, both our states and our national organizations, to make them aware of the 2020 updates, and use the briefs that will be coming out shortly for this, so that they can target the messages from the OA agenda, to really get the message out about what needs to be done, what is already working, what needs to continue, and then some new areas that still need some work to be done around them.
And we have a good question, I think, here to end on, from Penny Cowan at the American Chronic Pain Association, who asked, what is the plan to roll this out to the public to increase the number of people who actually get involved and get moving?
That's a great question, Penny, and your organization's been a wonderful member of the Action Alliance. So the plan is we're going to be reaching out to all of our members with the full agenda before it right before it launches on the 4th. We also have developed sort of a toolkit for the launch, so that people can do. It has social messaging. It has information about ways that people can push the agenda out there. We will be doing the CDC's. Laura, you can talk about what the CDC is going to be doing.
Yeah. So we have a whole sort of media outreach part of releasing the 2020 update. So we will be doing a whole variety of things, from posting the actual report on the CDC arthritis page. And then we're going to be doing a whole lot of outreach through social media, through the various CDC Twitter accounts, Facebook accounts, Instagram accounts, that will be starting on May 4th. And luckily for all of us, Arthritis Awareness Month is May. So we really are excited to be able to actually release the report on May 4th, which I think will be great. And then in addition to the postings of the report and then all of the social media, we at CDC are going to be doing a Dear Colleague letter from the Division of Population Health in the Chronic Disease Center, which is where the arthritis branch actually sits, outreach to them, giving them a link to the report and asking them to take a look at that information. And then lastly, we will be sending out a newsletter, an Adobe newsletter that will go to many thousands of people through our network at CDC to notify them about the report, that it's come out, and ask them to review that new information. That's the main updates that or the main media outreach venues and avenues that CDC will be using to get the word out about the 2020 update.
And we'll be doing a similar dear colleague or dear member to all of our member organizations and asking them to push it out through their media channels. And we'll similarly be doing all the same social media. And I think, and housing the agenda, and the Arthritis Foundation will be housing the agenda and doing media outreach as well.
And to those of you on the call and watching today, we will also be able to send you the agenda and send you information how to post it within your networks once that is released on May the 4th. So keep that in mind. We will conclude today's presentation here, and we thank you so much for joining us. Really glad that you are here. Stay tuned for an email later this week with a link to the recording. Feel free to watch that or share it with your colleagues. And then once the agenda is released on May the 4th, we will send that out to you as well. So thank you again for joining us. Just to plug next month's Lunch and Learn presentation, we will have that presentation on May the 20th. And our presenter will be Lindsay DiStefano, who's the Athletic Training Program Director and Department Head in the Department of Kinesiology at the University of Connecticut. And her presentation will be called Remain in the Game, a Joint Effort Injury Prevention Toolkit. So we hope you can join us for that. And we thank you so much for your time today.